Hello everyone, my name's Richard Jones, Editorial Director at Devex, and I'm delighted to be joined here today by Thomas Breuer, Chief Global Health Officer at GSK. Thomas, welcome and thanks for taking the time to talk to us.
Yeah, thank you very much.
Now we're here today to discuss health equity, how to leverage the power of partnerships for impact, and dig into both areas of progress and things that have perhaps stalled or even moved backwards during the pandemic. Perhaps I could begin by asking you to set the scene for our audience on health equity. Inequality and inequity clearly remain a persistent challenge for the health sector at large, but what's the scale of the problem here?
Yeah, so thanks for the questions. First of all, where you are born continues to define health outcomes. I'm from Germany, and if you pick any African country, for example, Ethiopia, the life expectancy is much lower there. You have limited access to healthcare. The overall mortality and the child mortality is much higher in countries like Ethiopia. So people can get trapped actually in a cycle of poverty, further deepening health inequalities. And second, more than 60% of disease burden in low and low middle income countries is from infectious diseases, and infectious diseases obviously don't respect borders. So within a country, high burden infectious diseases like malaria, TB or HIV disproportionately impact the underserved or vulnerable populations because of limited or no access to care. So what we have to do is to work together with the right partners. It's not just having innovative medicines or vaccines. We need to make them accessible for those who need them.
And Thomas, in terms of looking ahead to 2030 and the Sustainable Development Goals, what are the key steps in your mind to really accelerating progress, particularly towards SDG 3 on ensuring healthy lives and well-being for all?
So in one sentence, first of all, progress has stalled in reducing the burden of infectious diseases. Recent World Health Organization data show that the global number of malaria cases has increased since 2020. The number of people living with HIV is estimated to have increased by 1.5 million. The TB incidence is up, and vaccination rates in low and low middle income countries have gone down. So overall, disparities have widened, and in addition, problems with local distribution of medicines and vaccines have been amplified. So the question is, what can we learn in terms of approaching these challenges? We all have to get back on the horse and double down with our efforts to first get back to pre-pandemic successes. This cannot be done in isolation or in a disjointed fashion, so we all have to work together in partnership. And also local health system strengthening and capacity building are top of mind, as well as fostering adequate global and national funding, which has suffered as well over the last few years. So strengthening country ownership is a smart and sustainable way to go. And I give you one example. We have our African Open Lab initiative that is investing in African science, helping local researchers gain new insights into local infectious disease problems and come up with their unique solutions.
Now, in 2022, GSK announced an investment of £1 billion over 10 years to accelerate research and development dedicated to infectious disease, particularly those that disproportionately impact lower income countries. Can you talk us through this initiative and what specific R&D efforts are the focus here?
Correct. So a year ago, we announced an investment of £1 billion over 10 years to accelerate research as well as development dedicated to infectious diseases that disproportionately impact low-income countries. So 1 billion is obviously a huge number, but I would also like to emphasize that we committed over time, over 10 years, which is another important point. So we have the largest global health pipeline in the industry that is specifically focused on diseases that predominantly affect low and low middle income countries. So the aim is to progress around 30 potential new vaccines and medicine across 13 high-burden infectious diseases. And an integral part to R&D is obviously access and capability build as well.
And so 1 year into the commitment, what progress has been achieved? How has GSK worked with other partners in the process so far? And again, what are some of the main lessons that you've learned so far?
So we wasted no time in R&D since June 2022 and launched 6 clinical trials for diseases like malaria, TB, typhi, paratyphi, invasive non-typhoid salmonella, and Shigella. And in the preparatory work to start the phase 3 of a TB vaccine in collaboration with Gates MRI. But I would also like to mention our progress in access. We further roll out our malaria vaccine in Africa after we achieved WHO pre-qualification and the availability of Gavi funds. Access at scale through Gavi vaccines, where we reached a milestone of over 1 billion doses supplied since 2010. Another example is the elimination of lymphatic filariasis in Bangladesh, where which would have not been possible without partnerships, but it affirms our commitment to donating medicines against lymphatic filariasis until its elimination. And as far as capacity building is concerned, this year we are celebrating the 10-year partnership with Save the Children, a program which has reached over 3.5 billion children in 51 countries. And this unique partnership has brought together many aspects of GSK's business and Save the Children's expertise.
And Thomas, in terms of your work on HIV, could you unpack that a little bit for us as well?
Sure. Through our HIV business called ViiV Healthcare, there has been a progression on pediatric development programs for HIV treatment, increasing the age-appropriate treatment options for children living with HIV, most of whom, by the way, live in sub-Saharan Africa and access generic versions of these treatments via a voluntary licensing agreement.
Looking ahead, I just wondered if you could unpack for us what you anticipate to be the most persistent challenges when it comes to stopping the burden of infectious diseases in their tracks, and what concrete steps can be taken by global health actors and other stakeholders you're working with to really overcome those challenges.
Yeah. So for me, climate change and antimicrobial resistance, or AMR, comes spontaneously to mind. The impact of climate change creates new health threats and changing the spread and burden of diseases such as malaria, neglected tropical diseases, or enteric diseases. And already stretched health systems are under even more pressure and reinforcing health inequalities. The second thing is growing drug resistance infections add to the worries for health systems all over the globe. So that's why AMR is one of our most pressing priorities. So you asked for concrete steps to overcome these challenges. So we are using our science to find new medicines and vaccines for climate-sensitive diseases and expanding access to existing ones. Half of our global health R&D efforts are on climate-sensitive diseases such as malaria, NTDs, and enteric diseases. And 13 out of our R&D projects target pathogens deemed critical or urgent by WHO. So with science and the right investment, we can reduce the impact of AMR through prevention and treatment of priority infectious diseases and decrease overall health inequalities.
And perhaps finally, do you have a call to action to share with the broader development and health community? How optimistic are you that the outlook for really getting to grips with the issue around inequality and inequity as it pertains to healthcare? What's your call to action here, Thomas?
I'm notoriously optimistic, but the call for action for me has 3 points. First, we must continue to work together in multi-stakeholder partnerships. Nobody can do it alone. to support access to tools and redouble all efforts on infectious diseases with a new and additional focus on antimicrobial resistance. And second, we need an increased focus on how new and current tools will be rapidly made accessible to people in need in low and middle income countries. And last but definitely not least, more global and domestic funding is needed to ensure resilient health systems that can introduce and scale new products and ensure sustainable progress over the long term.
Ever the optimist. Many thanks, Thomas. I'm afraid we'll have to leave it there, but really appreciate you taking the time to speak with us today. And we'll be following your progress on this issue with great interest in the coming months on Devex.com.
Yeah, thank you very much.